minutes.
Okay. Did you know that 5.4 million Americans currently suffer from Alzheimer's disease? Alzheimer's disease is a brain disease that slowly destroys memory and thinking skills. I chose to do my speech on Alzheimer's disease because my grandmother just currently got it, and she has early signs of it, so I thought it was important to be informed about it. I think it is important for everyone else to be informed about it because it is a common disease, and you could know someone in your lifetime that comes down with it. So my research came from the NIC library online. I used the database, and all of the articles that I used were evidence-based sheets. They were either reviewed or written by nurses, medical doctors, or nursing executive practice counsel. Alzheimer's disease can be tricky to handle for the patients and for the people who care and love for them, but being informed about it can help us cope with the struggles of AD. So today I will cover the stages and symptoms of Alzheimer's disease. I will cover how it affects the caregivers and family members, and treatment options and ways to slow it down. Moving on to my first point. There are 4 stages of Alzheimer's disease, and the symptoms vary with each stage. So the first stage is preclinical stage. It contains a slow memory loss, and the symptoms include slight personality change, increased anxiety, and poor judgment. So the next stage would be the mild stage, and that's an increase in memory loss. And the symptoms are similar to the preclinical stage, but it also includes slow social withdrawal, moodiness, and disorganized conversations. The next stage would be the moderate stage. That's an even more increase in memory loss. And that symptoms for that one includes problems with recognizing family and friends, confusion, hallucinations, loss of impulse control, and inability to learn new things. The last stage is the severe stage. This is when the patient struggles to remember their family and friends. Some of them even lose complete memory of their family and friends. They have a lot of health issues, including weight loss, seizures, infections, and some of them can't even speak or walk. So this is what like a healthy brain would look like, and someone with severe Alzheimer's, very, very severe though. And moving on to my second point. Knowing the stages of Alzheimer's disease, we can already tell that taking care of a patient with Alzheimer's disease may be difficult and challenging. It does have effect on the caregivers and family members. So because caregivers spend an increasing amount of time with the Alzheimer's disease patient, there is a loss of energy and freedom. Also, they can become socially isolated. They get poor health, which is associated with chronic stress. Chronic stress is a long-term or continuous state of nervous arousal where an individual perceives that the demands on them are greater than their ability to meet those demands. So the effects that it has on family and caregivers, it could be depression due to the embarrassment of the patient's behaviors and obligation to provide care. Family members may also feel grief and loss. They may feel guilty, anger, and frustration towards their family member with Alzheimer's disease. And then a spouse usually gives up their own health needs and any outside activity like hobbies. And they also struggle and mourn over the change of the marital relationship. Moving on to my third point. There may not be a cure for Alzheimer's disease, but there are many treatment options to help cope with it. So one of the options could be medications. A common one is Donepezil, which it improves cognitive function and level of independence. So what it improves in the cognitive function, which is process by which one becomes aware of or comprehends ideas. It involves all aspects of perception, thinking, reasoning, and remembering. So with this medication, it can help improve that. And then patients who have mild, moderate to severe stage can take this kind of medication. Another treatment option is group music therapy. It has been proven to show positive long-term effects. So it's improved physical and verbal aggression because it allows them to express their feelings, concerns, memories, and even joke in a safe environment. So which also helps relieve stress and depression that they could be experiencing due to the Alzheimer's disease. So like most human beings, eating healthy and exercising is another way to feel better. But for Alzheimer's disease, it helps ease their symptoms. Drinking water is an important thing for Alzheimer's disease patients because they can produce dry mouth due to the body's signal for thirst, which is not as strong for Alzheimer's disease patients. Moving on to my conclusion, Alzheimer's disease patients can be tricky to handle for the patients and for the people who care and love for them. But being informed about it can help us cope with the struggles of Alzheimer's disease. So the 4 stages of Alzheimer's disease are preclinical, mild, moderate to severe. The effects that it has on family members and caregivers can range from poor health to even depression. So the treatment options that I mentioned were medications. There's lots of options for medications, music therapy, or even just talking therapy to help them express their feelings, and then a healthy diet. Okay, any questions? Yeah. So that one's good. Stop it.